Hi, everyone. My name is Lisa. I'm a nurse practitioner at Northwestern Chicago, Illinois. Um, I've been practicing for about 5 years. My expertise specialty is in melanoma and renal cell carcinoma. Today, I'm here with my colleague, Massey, who's also a nurse practitioner in general oncology. And we would like to talk to you about immuno-oncology and disparities and cultural competencies. I want to start with a question with Massey regarding are there healthcare disparities in oncology in general?
Hello, everyone. Thank you, Lisa, for the introduction. My name is Massey Nematullahi. I am the immuno-oncology clinical nurse specialist from Ontario, Canada, and I have more than 20 years experience in immuno-oncology from the time it was on clinical trials till now that we do have this advancement in immuno-oncology treatment. But to answer your question, Lisa, yes, health disparities in oncology does exist. Looking at different articles from American Association of Cancer Research, we know that health disparities exist in socioeconomic disparities, ethnic and racial disparities, geographic disparities, they all exist in general. And if I want to give you some examples, for example, in geographic disparities, for adolescents living in metropolitan area, they have a higher HPV vaccination rate compared to those that are not living in non-metropolitan area. Like African American men have prostate cancer that more than double than other ethnic groups. And the list goes on and on, but health disparities does exist. Also, for example, African American women, they have a double incident in triple negative breast cancer comparing to white American women. So these all exist, and we as oncology nurses have to make sure that it is our responsibility to follow the social justice in healthcare and ensure the high quality care is delivered to our oncology patients.
Thank you, Massey. That was really great. Can you please share some of your personal experience that you have experienced in your practice?
Sure. There are lots of examples that I can give to you. We live in the metropolitan area of Toronto. So it is, we do have people from all different backgrounds coming to the cancer center for their treatments. There are people that, for example, with low income, people with very low education, they cannot even understand or read the very poor health literacy to understand what we are talking about. People that they are rushing to leave the room when you are trying to educate them, and they say that is fine, I can get the brochure and then I can read that at home. We always are suspicious of they cannot even read, but they don't feel comfortable to let us know. I remember I had such a wonderful, lovely Vietnamese patient, and she was so shy, such a sweet lady, and anything with very good understanding of English, and anything I was telling her, she was just nodding her head and not telling me that to repeat the question, because she felt that she will take more of my time if she asked further questions for clarification. So there are people from different ethnicity group or with low income or LGBT groups. They are also having their own issues and challenges when they come to the clinic. So understanding these people, these health disparities does exist. And we have to make sure that we pay a very good and accurate attention to the patient or their family members that are sitting right in front of you. Some of them you cannot even have an eye contact with them, people with different religious background. So health disparities does exist in different population. I remember I even had another patient when they came to the room, they were sobbing with the newly diagnosed melanoma patient. And then when I offered them to have some water, they said, we don't want cold water. There should not be any ice in it. Like it is very simple. What you, at the very beginning, you want to establish this relationship with your patients, you have to consider so many things when you want to try to understand them and make sure that the education and the care will be the most successful one for you, specifically when you're treating patients for cancer, because it's really just having a cancer diagnosis itself is really hard for them.
Thank you, Massey. I think these are very important topics to discuss and have better understanding of the issues in our practice as well. So I really appreciate your thoughts and your expertise.